Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show.
Sunscreens are a part of comprehensive photo protection, which includes sun avoidance. This is the most important and most desirable part of photo protection, that is, just avoid sun. At any cost, you are unable to avoid sun, you have to go outdoors to do work. Then you have to seek shade, wear protective clothings like full sleeves, wide brimmed hats, protective goggles to protect your eyes, and finally you should use a sunscreen as a last part of the comprehensive photo protection. Photo protection means not just mere usage of sunscreen. After advising all these things to the patient, at the end only you have to prescribe and advise to use sunscreen. From where we can get sunscreens? In any medical shop, if you just go and ask that you want a sunscreen, they will give you, because these are over the counter drugs. They won't ask any prescription from a certified doctor. How many types are there? Two types. One is chemical sunscreen, another one physical sunscreen. Chemical sunscreens will absorb the UV rays without harming your skin. Physical sunscreens will block the UV rays, not allowing UV rays to harm your skin. That's why I have written here physical blockers, chemical absorbers. These chemical sunscreens contain organic particles. Physical sunscreens contain inorganic particles like metals, zinc oxide, titanium dioxide. If this particle size is more than 200 nanometers in physical sunscreen, they will block all the radiations. That's why here it is called as broad spectrum sunscreen. Physical sunscreens are safe in children and adults with allergy. The only drawback with physical sunscreen is it leaves behind a white cast. We all must have seen cricketers applying white sunscreen all over the face. But with chemical sunscreen, they are cosmetically elegant. That means you can't appreciate whether they have applied chemical sunscreen or not, but you can easily identify a person who have applied physical sunscreen with the help of this white cast on his face. Physical sunscreens works immediately. The moment you apply physical sunscreen, they are ready to block UV radiation. But for chemical sunscreens, we have to wait 20 to 30 minutes. Physical sunscreens are photo-stable, whereas chemical sunscreens are photo-unstable. But with the usage of vehicles formulations, they have made photo-stable. That's why I have written variable photo-stability. Chemical sunscreens have more irritation and they are allergic. Remember, chemicals are allergic and will cause irritation. Physical sunscreens will cause less irritation and they are non-allergic. That's why here it is safe for children and in adults with allergy. Coming to chemical absorbers, UVB filters, that is PABA derivatives like PABA and Padimate O. Salicylates like homosalate and octisalate. PABA derivatives, PABA. Salicylates, salates. Cinnamates, cinnoxate, octinoxate. Others like N-sulizole and octicrylate. These are all UVB filters in chemical sunscreens. Coming to UVA filters, benzophenones like oxybenzone, dioxybenzone, sulizobenzone. Others like avobenzone, meramidate. This is the classification of sunscreens. When we can say a sunscreen is broad spectrum, if the products are with critical wavelength of 370 or more, then that sunscreen may be labeled as broad spectrum. What is this 370 nanometers? Here you can see wavelength of UVC is 200 to 290, UVB 290 to 300, UVA 320 to 400. Here UVA is ending nearest to 370 or more. If any sunscreen is protecting us until 370 nanometers of wavelength, then it is protecting us from UVA radiation also. Then we can call that sunscreen as broad spectrum. Broad spectrum is related to whether it is protecting us from UVA or not. Sun protection factor refers to whether it is protecting us from UVB or not. Remember, broad spectrum UVA, critical wavelength UVA, sun protection factor UVB. Most of the sunscreens are protecting us from UVB. We have to check whether it is also protecting from UVA or not by critical wavelength if we want broad spectrum protection. What is SPF? It is defined as minimal erythema dose of protected skin. That is, skin which we have applied sunscreen at the quantity or thickness of 2 mg per centimeter square by minimal erythema dose of unprotected skin. That means without any sunscreen. In simple terms, minimal erythema dose with sunscreen divided by minimal erythema dose without sunscreen. What is this minimal erythema dose? It is the minimum dose of UV radiation required to produce visible erythema on the skin after 24 hours. With sunscreen and without sunscreen. If this SPF is high, that means we can tolerate sunlight for much longer time if we apply sunscreen than without sunscreen. If SPF is 2, it will protect or block UVB rays 50%. If it is 15, 93%, 30, 96%, 50, 98%. You can clearly see the protection does not significantly change. If we increase SPF from 30 to 50, it has changed just 2% only. So there is no much difference from SPF 30 onwards. You can use SPF 30 sunscreen safely. If you apply enough amount, that is 2 mg per centimeter square, because at this concentration only this SPF is calculated. Vehicle type is crucial for determining sunscreen's efficacy, aesthetics, durability and water resistance. If the vehicle type is gels, we can prescribe for oily skin, lotions for dry skin, sprays for thin hairy scalp. If we use sprays for face, we may get uneven distribution. We may spray huge amounts at one place and very less amount at one place. This will lead to uneven distribution. Wherever we can't apply evenly with our hands, we can use sprays like back over thin hairy scalp. How much we have to apply? 2 mg per centimeter square. This is adequate thickness or concentration or quantity of sunscreen which we have to apply ideally. To apply this much, we have to follow teaspoon rule. That means we have to take 1 teaspoonful and apply for face, head and neck. 2 teaspoons for upper extremities, 1 for each. 2 teaspoons for trunk, front 1 teaspoon, back 1 teaspoon. 4 teaspoons for lower extremities, 2 for each leg. Wherever we go, we can carry sunscreen, but along with sunscreen, we can't carry a teaspoon with us. So for easy and more practical approach, we have to apply sunscreen in 2 coats, just like paint on the wall. If we miss any areas during first application, we can cover it up in second application. But it also ensures that we have applied thick enough. That is 2 mg per centimeter square. Simply we can apply 2 times. Coming to indications, many skin diseases are photo-induced or photo-aggravated. So sunscreens will be very useful in these conditions. Coming to FDA approved uses, that is sun burns, skin or lip damage by sun, skin discoloration or freckling, skin aging or cancer. Mostly this is induced by UVA radiation. So we have to use broad spectrum sunscreens which will cover UVA radiation also. Coming to off-label uses, photosensitive and photo-aggravated skin diseases like xeroderma pigmentosum, PMLE, LE, erythropoietic protoporphyria. In porphyrias, porphyrins will be waiting for visible light. Whenever visible light falls on them, they will react and cause skin rashes. So it is important to block this visible light with sunscreen. In LE patients, if they have went out and exposed to sunlight now, they may get skin rash weeks later. So that patient may argue with us, in recent times I have never went outdoors, why I am getting skin rashes. In PMLE, patient will give proper history that I went to outdoors and I got this rash. Xeroderma pigmentosum patients, their DNA repair mechanism will be lost. That means if we go and stand under sunlight will damage our DNA, but our DNA repair mechanism will immediately repair it without inducing cancer. But in xeroderma pigmentosum patients, they are not having a proper DNA repair mechanism. If sunlight falls on the cells, it will cause cancers. That's why they have to follow rigorous photo protection. That means not just sunscreen, using full clothing, wide brimmed hats, UV protective goggles, even clothes also they can soak it in UV filters and wear them while going outside. They can't even enjoy early morning sunrise and sunset also. If we are healthy, health is the only wealth. Even if we are healthy, we will be crying for more wealth. Some people may go to foreign trips even by spending lakhs of money, but still can be unhappy. Someone may go to the nearest temple with absolute zero amount, but still can be extremely happy. Happiness and money have no connection at all. Happiness lies here, not here. If you are fully healthy, just be blessed and thank God for whatever things you have. Don't pray and irritate the God for whatever things you are not having and you want to have. There are so many patients out there crying for things which you already have. Stopping philosophy here, we'll continue the class. Contraindications. Known hypersensitivity. For any drug, it is the common contraindication. Less than 6 months of age as a sole component of an overall program of photo protection. Just don't prescribe sunscreen. You have to advise protective clothing, avoiding sun also. Adverse effects. Subjective irritation. Stinging, burning and itching, contact urticaria. They may be immunological or non-immunological. Immunological means IgE induced release of histamine from mast cell. Non-immunological means without IgE, independent of IgE, mast cells may degranulate and cause urticaria. Irritant and allergic contact, dermatitis, comedogenicity, folliculitis, phototoxic and photoallergic reactions. These are seen more with chemical sunscreens. Remember, like this, chemicals will cause reactions, phototoxic reactions, photoallergic reactions. Theoretical inhibition of vitamin D synthesis. Synthesis of vitamin D3 occurs at 310 nanometers. Remember, D3, 310 nanometers. All of the sunscreens will block UVB rays. So, whoever is following vigorous photo protection, that means I have said what is rigorous photo protection for xeroderma pigmentosum patients. They have to take vitamin D 600 international units as supplements. This is nothing but recommended dietary allowance of vitamin D. And for those who have crossed 70 years also, their recommended dietary allowance will increase to 800 international units per day. Coming to oral photo protection. Not only topical applied sunscreens will protect us from sunlight, but also orally some ingredients which we consume will also protect us from sun. What is oral photo protection? It refers to consumption of one or more active ingredients to reduce skin damage by sun. These are just a complement to sunscreen, not a replacement, as they are incapable of physically blocking the penetration of UV rays. This oral photoprotection, we can use it as a complement only for sunscreens, not a replacement. Because how this oral photoprotection works, UV radiation induced oxidative, inflammatory and immunological damage, they will reduce. These active ingredients, oral photoprotective active ingredients will reduce UV induced oxidative, inflammatory and immunological damage. Once UV radiation enters the skin, then it will cause oxidative damage, inflammatory damage, immunological damage. All these damages will be reduced by our oral photoprotection. So it will complement sunscreens. Sunscreens will not allow UV rays to enter. Even if some of the rays enters, then oral photoprotection will take care of it. This oral photoprotection is not affected by external environment. Sunscreens may get wiped off with water like sweating, swimming, but oral photoprotection is not affected by swimming and sweating. However, if we take anything systemically, they may have systemic side effects. Coming to ingredients of oral photoprotection, mainly all these ingredients are antioxidants. Vitamins like C, ascorbic acid, E, tocopherol, B3, nicotinamide, A, beta carotene. Beta carotene is precursor of vitamin A. It comes under carotenoids only. Next, carotenoids, astaxanthin, vitamin A, carotenoid. Astaxanthin, carotenoid. Lycopene is also a red pigmented carotenoid. Then caffeine, green teas. Polyphenols is of two types. One is flavonoids, non-flavonoids. Under flavonoids, isoflavones, catechins. Non-flavonoids, phenolic acids like gallic acid, resveratrol. These are non-flavonoids. This is the classification of antioxidants. We may get question just antioxidants in DVL. You can just write all these antioxidants and you can write what UV radiation will do, and these antioxidants will prevent all those damage induced by UV radiation. Remember the channel name. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.